I come from a healthcare background. I'm not a doctor, but I've been a nurse on the floor, in the emergency room. I worked in quality assurance, risk management. And you know, when I'm listening to the conversation, first I want to align myself with my colleague on rural resources, Kathy Young, because I think that home health care in upstate New York, in a rural area like mine, is difficult enough, and I think that we have to look at the uniqueness of each area, and they are very, very unique. Transportation issues, there are so many issues. You know, the average income in my area is about $25,000 to $30,000. So we're talking about a very, very diverse, poor community. And over the years in healthcare, you know, we created technology, we tried to computerize the doctor talking to the lab, talking to the pharmacy, and you know, we begin these projects, but we don't ever seem to finish them, and that's very upsetting to me. And you know, as a legislator, and I've been on both ends of the spectrum, sometimes I think we legislate from the top down, and to me, the best information comes from those people that are working in those rural hospitals, that are visiting those patients. And you know, we've come a long way with telemedicine, but it's underutilized. And what we're doing right now is we're changing it, and we have this knowledge about efficiency, efficacy, the whole 9 yards, and we have the information, but it takes us so long to get from point A to B with what we have, and then instead of using what we have, we're moving on to something different. And my fear is at the beginning, home health care wasn't at the table, but we're talking about people, and when we talk about the cost of Medicaid, we're talking about spending $2,000, and I guess I'm on a speech pattern, I'm not asking a question, but I have to say it because, you know, I'm a softie, and I love what I do, and I love people, and I believe that, you know, health care is something that we all deserve, and quality health care, not just if you have a buck in your pocket. But, you know, I think that sometimes we should involve more people. You know, I begged to be on some of these committees, and of course, my name was not called. And there are people that, you know, I've called office upon office, and I think that there's a better approach than, again, from the top down. And Jason, I know you have great experience, but, you know, visit our communities, come up and let us tell you how our community is functioning. You know, we had, you know, point of service, it was a flop. Absolute flop. So we've tried all these things, and if we're going to try something new, I want it to work. And I want to make sure that we think about the person. And you know, when we talk about Medicaid, and you know, people scream and yell and holler, $30,000 versus $2,000. The poor, $2,000 we spend a year, but the fragile adult, you know, the Medicare system. And you know, I want to talk about pharmaceuticals that's driving up the cost of health care, talk about, you know, insurance companies that are making record profits, and let's not take the health care away. Let's go after those corporate industries that are really gouging the population. So I hope that, you know, you'll involve more from the bottom up rather than the top down, and when we do it, make sure that we have the patient and the person, you know, first on our minds.